morning, everybody. My name is Dr. Songwut from Thailand. Today, my topic talking about this. I have nothing to disclosure. The TLIF is one of the most common procedure of the interbody fusion, as we know, because of the favorable outcome and result. But this decade, the endoscopy has been developed and very, very famous. The term of the UBE TLIF, I think not important to describe this term. The one of the most common complication of the interbody fusion is the case of subsidence. Especially in the multiple level of the interbody fusion, we need the aim of the correction to be the correction the deformity. If the case of subsidence, maybe can read deformity. And on the area of the foraminal, you see this collapse, the foraminal may be the restenosis. Some case in the subsidence have a pseudarthrosis. All of this is leading to be the poor related outcome of the patient. I correct the data about 72 patients and 81 fusion segment evaluated from the pain X-ray at 1, 3, and 6 and 12 months, and CT scan following at 6 and 12 months. The fusion length assessed by the Biportal grading system corrected data such as the age, the sex, body mass index, marking and corticosteroid use, operative level, and multifidus muscle fat atrophy, different this height at the cast size and the cast position. The subsidence, the definition is the case was sunk into the vertebral body more than 2 millimeters. You see on the left picture, the case no subsidence. The fusion, you see the fusion tubercular formation across the case. On the right side, you see on the right side picture, the case was sunk into the vertebral body in the upper level, more than 2 millimeters. This is the subsidence. The disc height, I measured the disc height before pre and post-operative and corrected data like this. The case position, the definition is I evaluate from the CT scan in the axial view. The midpoint of the case, if the midpoint of the case on the posterior half of the vertebra is called the case on the posterior position. If the midpoint of the case into the anterior half of the vertebra is mean the anterior position of the case. For the result, you see that we found the BMI and case height more than 10 millimeters and a different disc height and case on the posterior position. This is the risk factor of the case of subsidence. And then another analysis, BMI more than 25, the odds ratio about 3.7. And the case height is more than 10 millimeters. The odds ratio about 4.2. And the case position in the posterior, I found the odds ratio about 3.5. The highest strong factor is the different disc height. We found the odds ratio about 6.3. Because of, I think, the axis of rotation of the spinal segment on the posterior, if the case on the posterior position, maybe increase the loading force, it may be leading to the subsidence. And the case height, I recommend to use the proper size of the case, no overstop or no over the oversize. Maybe increase the load into the end plate. This is the cause of the subsidence. We found if the BMI more than 25, I always discuss with my patient about the risk of the subsidence and things like that. The limitation of this research because of I just only the retrospective study, and this study did not include the BMD. I think the BMD may be the strong risk factor of the case of subsidence. Okay, thank you.